today we're here to celebrate the International Nurses Day, which is actually on Sunday, the 12th of May. So we brought together nurses from a variety of backgrounds, working in acute hospitals, mental health, community trust, the ambulance service, care homes, you name it. We've invited everybody here to celebrate the day. We're intending to use the event for nurses to get an opportunity to network. We've got a number of workshops, topics that we'll explore, and hopefully at the end of the day we want to come up with some actions that we want to take forward as a collective group of nurses working across Dorset.
I've been asked to come and talk to you about the national picture for nursing. I'm really proud now to be the chief nurse for the South West region. And I see myself as your representative around the table for our national colleagues to understand how it really feels and what the challenges are unique to us in the South West and how we can also celebrate the fantastic work that you are doing.
Nursing in the ambulance service is quite a small group of people. It's a very diverse group of mostly paramedics in the ambulance service. It's been great to be invited today and meet a load of nurses and see how across Dorset all the different systems, whether that's primary care, secondary care and other sectors are looking at improving patient care and how we also train and recruit and retain nurses for the future across the whole sector. And it's kind of great because for example, there's only 2 of us in our team that are nurses. Within Dorset and Somerset, and so it's great to be able to come and meet other people from across the region and see what their difficulties are, what they're championing, and then the positive things that are happening within nursing across Dorset.
I came onto the conference to find a little bit more about what's going on within the nursing role and what's going on within Dorset Healthcare to support nurses and improve practice.
It's really about you, the workshop. My name is Geoffrey, I'm Matron at Poole Hospital. I came along to the conference today. I'm also facilitating a workshop, but most importantly to look at the inspirational work that's being done by nurses throughout Dorset and also to get some ideas myself. I think sharing and networking is really important.
Fantastic, everyone's here and it's got a really good buzz and people are really excited and enthused. For the take-home message, I suppose, for people today is about them feeding into ideas in terms of actually what do we need to do to retain our existing workforce and how can we strengthen our placements for all of our learners.
We're doing a collaborative project. We're finding out what factors affect nurse retention and then we're evaluating what happens afterwards. So there's sort of a survey involved and there's also some interviews. So it's a piece of research, but it's been done collaboratively with the hospital.
Probably one of the biggest challenges we've got at the moment within nursing is getting enough people into the nursing workforce. So we've got great people that work for us, but we need more and more of them. And we've got an increasing demand as we've got an elderly population that are becoming older with more complex needs. And so one of the key things that I'm doing is trying to encourage young people into nursing as a fabulous career option.
There are real opportunities for nurses in Dorset to actually rethink how they work and how they deliver services.
I think everybody in this room would, like me, they're extremely proud of being nurses, but we're also aware there's huge pressures and challenges there.
From what I've been listening to today, there's an array of initiatives and things that are being championed to ensure that patients get the best care. So I think that's the most positive thing for nursing in Dorset.
It's been fantastic to hear about all the other projects that have been going on around Dorset and just how much work nurses are doing to promote independence of patients and also seeing and meeting lots of new faces and new colleagues that I hope to see in the future.
Do you know what? I love every minute of being a nurse. I've been a nurse for 34 years and the job that I do at the moment, Matron, is perhaps the best I've ever had because you combine influencing and decision making and moving services with actually delivering care.